Hi all. So let's discuss today about skin tags. Nobody loves skin tags, isn't it? Because that's the reality. So what is skin tags actually? We know that some of us will be having, most of us will be having it in our face, behind our ear, on our neck or on our breast area. So they are small, smooth structures that is closely attached to our skin with a little pedicle like that. Okay. So we don't like that, isn't it? Because its color is, some of them will be having it in white color, some of them will be having it in black color, etc. So some of them they will be having mostly in their lower limb area. So which are this lower limb area? Lower limb area means in your thighs, in your knees, near your buttocks, etc. So why it is occurring? We know that it does not occur in our 10-20s ages, isn't it? It occurs after the 30 years of age. So why this 30 years of age? Because on this 30 years of age only, our body is undergoing many hormonal changes and all, isn't it? So first actually what is happening is that the keratinization of the skin is happening. Okay. So the keratinization of the skin happens mostly on our this neck area and all. So whenever we are obese or over fat or when we are diabetic and all, so what happens is there is a skin friction causing in between this. So when there is a skin friction causing in between the two structures, the small structure is developed actually, and it is having a little collagen and is getting a little blood supply also. So if ever we try to prick it with our hand, we know that for some of them it will be possible. There will be a little bleeding. Okay. So as it is having a little collagen and all, we can easily remove it by electric cautery. So but we have to know what are the reasons that is causing this, how we can stop this, isn't it? So what happens after the 30 years of age is that most of the ladies, they will be undergoing hormonal changes because of the pregnancy. And otherwise also some of them will be having this PCOD problems, this insulin resistance, then after pregnancy, during pregnancy. So these time and all actually our body is undergoing many changes. So whenever body is undergoing many changes, it is actually precipitating this formation of skin tag. We know when we see after, we will be thinking, oh, I didn't have this on my 25 years or my 22 years. Why is this happening? This is the main reason. So if your pancreas is overworking, if you are having insulin resistance, if your insulin metabolism is not correct. So these are the some of the reasons why this structure is formed in our body. So what can we do? What we can do is that let's try to do exercise. So why we have to do exercise? If you are doing exercise correctly, what happens is that at least you can reduce the size of the skin tags. Okay, so once it has occurred, then if it has occurred, what we can do? Let's try about some of the home remedies and some of the Ayurvedic remedies, and let me explain you about the electric cautery procedure. So first let me explain this electric cautery procedure. So when you go and see a cosmetologist, what they will be doing is that first of all, they will be cleaning this particular area with a betadine lotion. Then they will be putting a numbing gel. Why to put a numbing gel? Because electric cautery is a little painful procedure. Okay, so numbing gel will be applied to about 25 to 40 minutes. After that, then they will be doing this electric cautery. So when they do this electric cautery, actually this thing is easily get detached from our skin. I told you, isn't it? It is having a little blood supply and a little collagen structure. And after that, they will be giving you some antibiotic cream and all, and you can apply it on a daily basis. And within next day, what you can see is that there's a pinpoint scar will be there. Yeah, because I told you, isn't it? It is having a little collagen and a skin structure. So then after few days, it will be going. Okay, so this is what the electric cautery procedure. So let's check about the home remedies. Home remedies, what you can do is that apply a little lemon juice on that particular area, bandage it for a few days, then it will be going off. Next main thing is apple cider vinegar. So how we can utilize this apple cider vinegar? Apply apple cider vinegar on this area of skin tag, then you can do a bandage, then after a few days it will be again flipping off. Then let's do one thing with a little castor oil. What we can do is that add a little soda powder, and that also we can bandage it, then few days it will be gone. But I am telling you this home remedies, don't take it for granted, because if you are a person with diabetic conditions, don't do this things, because it is an aseptic procedure. As it is an aseptic procedure, what happens is that there are chances of infection and all. So I will not be telling you to pluck it and remove it and all, because this all can cause infection, right? So you can see your physician and they will be telling the easy way to how to remove. Now let's check about the Ayurvedic ways how we can get rid of this. So Ayurvedic ways how we can get rid of this is that, do you know glycyrrhiza glabra powder? Yeah, it is Yashti Madhu powder. Yashti Madhu powder, you can apply it with a little honey on this particular area. So when you apply it in a particular area, what happens is that after a few days it will be actually becoming a pus and then it will be going off. And next main procedure is, with the glycyrrhiza glabra powder, what you can do is you can fry it and then you can apply it with a little honey. This is also the second step. And Ayurveda, actually we used to prepare Apamarga Kshara. Apamarga Kshara, how you will be applying is that you will be applying it for 20 minutes for 2 to 3 days. But again I am telling you, don't go and do this directly, because Apamarga Kshara, if you put it more than 20 minutes, it can result in keloid formation. Keloid formation, those who have keloid, they know it is a very difficult to remove the keloid if it has happened to our skin. So always take the advice of an Ayurveda physician. That is what I am planning to tell to you. Okay, so these 3 steps can be helpful for you, but always what I am telling is that let's work on the causative factors. And another main thing is genetics, actually, because if anyone, if your siblings, your parents, anyone will be having the skin tags, you will also be definitely developing skin tags. So let's check about what all we can do to, that is, let's do this exercise and all, and let's do the steps to reduce this insulin resistance. That can definitely will be helping you. So hoping that these tips are helpful for you. We can see on another video. Thank you, dears.